What are some of the latest updates in the management of neuroblastoma? Dr. Jeziorczak reviewed this topic at the 2022 Pediatric Surgery Update course.
16-month-old right adrenal mass, measures 8 centimeters. Biopsy of the mass, favorable histology neuroblastoma. Biology, no McN amplification, but has segmental chromosomal abnormalities. What is the best next course?
He shared a recently updated paper from the Children's Oncology group showing that the neuroblastoma tree is constantly changing as we're adding new information.
So this would actually be a high-risk tumor based on the 2021 COG.
They reviewed patients enrolled in trials between 2007 and 2017 and found that the presence of segmental chromosomal aberrations, such as the loss or gain of a portion of the chromosomal arm, can have a negative impact on patient outcomes.
Again, this arm that highlights change in the schemata, making it high risk as we're looking for the non-amplification, and now that next arm or next branch of the tree where we're looking at those segmental chromosomal abnormalities. And it's great. We've evolved and we're getting a lot more data a lot more rapidly on some of what the genetics are and what the tumor biology is and how these kids will respond and how they should be treated.
Thanks for joining Dr. Jeziorczak and the rest of the APSA Professional Development Committee for this update course rewind. Be sure to check out more pediatric surgical content on the Stay Current app. Along with Cincinnati Children's, we're sharing knowledge to improve child health around the globe.